Preoperative calcitonin testing improves the diagnosis of medullary thyroid carcinoma in female and male patients. By Weber et al. Background: calcitonin is produced by parafollicular C cells in the medullary region of the thyroid. It is an almost exclusive tumor marker for medullary thyroid carcinoma, MTC. Despite this, its use for preoperative screening of MTC in patients with thyroid disorders is still controversial. Aims of the study: define calcitonin cutoff levels for the diagnosis of MTC in men and women undergoing thyroid surgery, and evaluate correlations between calcitonin levels, tumor stage, and biochemical cure rates. Methods: data from over 29,000 patients who underwent primary thyroid surgery was recorded and evaluated. 357 of these patients were diagnosed with MTC. Results: patients with MTC showed significantly higher preoperative calcitonin levels than patients with benign thyroid diseases. The diagnosis of MTC becomes more evident with increasing calcitonin levels. Receiver operating characteristic curves were used to define calcitonin cutoff levels for differentiation between benign thyroid diseases and MTC. The best threshold for calcitonin was 7.9 picograms per milliliter in females and 15 picograms per milliliter in males. Larger tumors and increased number of lymph node metastases were both associated with increased calcitonin levels. As the number of lymph nodes involved increased, the biochemical cure rate decreased. Conclusion and importance: routine screening of calcitonin before thyroid surgery is recommended, and an ultrasound scan of the thyroid should be performed if calcitonin levels are above the defined threshold. Management should then depend on the result of the sonography. This routine screening will allow MTC to be picked up earlier, improving prognosis. To read the full article, please follow the link provided or scan the QR code.